for tuning on today. Welcome to another edition of Talking Finance with Gail. I really want to appreciate all those that were able to watch my very first video. I really do appreciate. Thank you guys. And please do not hesitate to share this one as well. And please subscribe. Click the subscribe button below, so I could be able to get more views and be able to educate more people. So today I just wanted to be able to share some light on what people are not aware on, or how to save money using health insurance. A lot of people, especially in the United States, do not understand health insurance. I mean, some people will get insurance because they feel like, oh, it's necessary for them to get it, but they really do not have a clue of what to get. Sometimes, when their employers would give out plans to them, they don't know exactly what to choose because there's some certain words they don't have a clue about. They'll give them 2 3 pages of paperwork, and we have a second set of people like I myself, I was in that situation where you think you're getting insurance, you get insurance, and you think you go to the hospital and you get your bills paid, and your bill is sent and nothing is being paid by the insurance, and you're like, okay, what's going on? Why haven't they paid my bill? I pay insurance every month, but why haven't they paid it? That is because a lot of people do not master, or they have not had a mastery of what to look out for when getting health insurance. So that is what we're going to be talking about today. But before we get into the specifics, I want to first of all talk about 3 key words we have to understand about insurance. The first keyword is a deductible. The second keyword is a copay. Third keyword is a premium. The first keyword, which is the deductible. What's a deductible? It's the amount of money, or the amount of bills, I would say, you have to pay before the insurance can start covering your plan. So, for example, if you get a plan with a $1,000 deductible, you have to pay bills worth $1,000 before the insurance company can continue paying for that policy, or can start paying for the policy. So until you've not gotten to the point where you've paid $1,000, the insurance company will not pay any bill until you've gotten to $1,000. That's just an example. So your deductible could be 6,000, 5,000, 1,000, 200, 300. Like in my case, I have TRICARE because my husband is in the military, so our deductible is something like $300. It's really low. So it does depend on the kind of policy that you have. And which leads me to the next thing, which is a copay. Usually when you reach your deductible, you get to a next stage where it can be a copay. Some people have 100% copay. Some people have 80/20. What's 80/20? So it means the insurance company would pay 80 and you're gonna pay 20. And another thing is, it depends on the insurance company. It depends where you work at. Some people would make it 60/40. Some people would make it 90/10. So it depends. And sometimes you also have co-pays that are stipulated prices, especially for stuff like a physician. If you're going to go see a physician or primary care physician or a specialist, they might have a specified amount for a copay. So no matter how much the bill is, they might be like, okay, copay to see a primary care physician is like $10. A copay to see a specialist like $45. Like in my case, I sold Medicare products. I sell Medicare products as well. So if you're interested in Medicare or getting more information about how to get Medicare products when you retire or you turn 65, you can contact me, or you can email me at 5minuteinsuranceservices@gmail.com. I can be able to highlight you on what's better for you when you retire. That is another thing. You have a lot of ways that copays are being dealt. As I said, it does depend on the fine print of your insurance. That's why it's so important to read that piece of paper that has been given to you, because there you have your deductibles, you have the copay, able to choose whatever is good for you. Then the third thing is a premium. A premium is the amount, it's just simply the amount you pay for the policy. And it varies. With most companies, it's not just one premium. It would depend on the deductible. So a premium, like in my case, in my very first company I worked with, the premiums were in between $30 every 2 weeks or every paycheck up to about $95. The highest was like $95 every paycheck, which is about 190 every month. So let's put this all together now. How do you get a perfect policy? It depends on a lot of things. One, it depends on your family situation. If you're in a family situation where you do have kids, you have to factor out the probability that anybody can go to the hospital at any time. You have a woman in the house. Women usually would get exposed to stuff like we need to go to for wellness checks and stuff like that. You need to factor out your insurance according to how you also go to the hospital. We have patients, we have diabetics, we have people that have cancer. You cannot be getting a low policy, or you cannot be getting a low premium policy when you're someone that is a constant goer to the hospital. What do I mean? In simple terms, the higher your premium, the lower your deductible. So what it means is the more premium you pay, the lesser your deductible would be, which in turn means that the insurance company would start paying early for your bills. And you have to remember something. Most of these things are only for a year long. So a deductible is just for a year. When you get to the next year, you restart from zero. So I guess you guys can see how all these three aspects of a policy can obviously help you guys to be able to save and be able to take care of your family better when it comes to getting the best or getting the most suitable health insurance that could be able to give your family a better coverage. So if you have any more questions, or if you are more inquisitive about finding out about more things about health insurance or anything Medicare, you can get through to me, email me, or you can write down on the comments below. I could be able to answer your questions. It was really nice talking to you guys today. Please subscribe, and if you really love the content today, give me a thumbs up on the in the bottom of the video. Thank you guys. I really do appreciate. God bless, and see you guys next week for another edition of my videos. Bye bye.